Hi everyone, my name is Sarah. I'm here to talk to you today, and I'm from Arizona State University. I'm a sophomore studying biochemistry and global health. Now you might be thinking, why am I here today talking to you about HIV treatment? But I have been learning and studying with professors in sexual health and HIV over the past couple of months. And so I humbled myself in learning this material to be able to have this conversation with you today that not many people have. So I want to acknowledge that and appreciate you guys for coming today and having this conversation with me. So to begin, just keep in mind that there is a bathroom and water fountain outside if you need it, and if you need to answer any phone calls or anything, you can just leave the room for a quick second, then come back, no problem. And I'm hoping that today will be a safe space for us, but in order to make that happen, you please feel free to ask questions, have comments, concerns, anything like that. I'll be here to talk to you after and also during the conversation. So to begin, there is no cure anywhere in the world for HIV, but there are life-saving treatments available that ensure someone can live a long, happy, and healthy life. And a second important outcome of treatment is that it makes it impossible for an HIV positive person to transmit the virus to someone else after getting treated. Um, and the only way to access this life-saving treatment is for someone to know their status. And the only way for someone to know their status is to get tested. So get tested, know your status, and get access to life-saving treatment if needed in order to break the cycle of HIV transmission. So the first key concept that we are going to talk about today is ARVs. And there's a what, who, when, where, and cost that all revolve around ARVs. So when I was first learning about it, I had no idea what they were. And maybe that's you, maybe it's not, but it's always important to review that. So ARV stands for antiretroviral treatment, and they work in the body to lower the amount of HIV that are in the body. Um, and it's a mix of drugs. It's a drug cocktail that reduces the amount of virus in the body by stopping viral replication. And if virus replication is suppressed with this drug, an HIV positive person will not progress to AIDS, which is the disease that forms from the illness of HIV. And the only way to access to get access to ARVs is for someone to know their status. So again, get tested. Everyone deserves a test. Know your status, get access to life-saving treatment if needed. And in order to, and after doing that, life-saving treatments are become available. So when should someone who is HIV positive start taking ARVs? As soon as possible. So once someone gets tested and is positive for HIV, it's super important that they get treatment as soon as they can in order to prevent further progression and transmission to their loved ones, right? Ultimately, we're finding ways to protect and keep our loved ones safe. And in order to do that, someone who's HIV positive should start taking ARVs as soon as they get their positive test. And in order to take these ARVs, it's important to know how to access them. And the only way to access them is to get tested. So if a person tests positive for HIV, they'll be prescribed by ARVs by a healthcare professional. And again, in order to get those ARVs, you need to get tested. So get tested, know your status, and get access to life-saving treatment if needed in order to break the cycle of HIV transmission. So you might be wondering, what does taking treatment look like? Well, it's taken once a day for the rest of someone's life, because in order to be virally suppressed and therefore not have to progress to AIDS in someone's body who's HIV positive, they need to take their medication once a day at the same time every single day. And this can compare to birth control. It's a pill that takes less than or up to 10 seconds to take, just like birth control, taking it every day, once a day. And so another aspect that it's important to talk about is adherence. And so it's super important for someone that is HIV positive to take their treatment consistently in order to reduce this drug resistance. And if it's not taken consistently, the drug will not be suppressed to the extent that it needs to be in order for the person to stay healthy and not transmit it, or also turn to AIDS from HIV. So someone might be wondering, what are the side effects that come with taking these drugs every day? Well, It's important for an HIV positive person to take their drugs every day. And it's not often easy because of side effects, but it's important to talk with a medical professional about the side effects of the drug because they can be treated. And the benefits of taking ARV, as we've been talking about, outweigh any side effects, right? You're protecting your loved ones, you're protecting your family members. And you're breaking the stigma around getting an HIV test. And if you're positive, you're breaking the stigma about where to get that treatment for you. And you're protecting your loved ones, and you're living a longer and a happier life if you if someone gets the treatment that they need. So the next step that we can talk about is undetectable equals untransmittable. So we've talked about how ARVs are life-saving and how an HIV positive person can live a long and healthy life by taking ARVs every day. But another aspect is that taking ARVs and having a suppressed viral load is that if virus levels in the blood are undetectable, an HIV positive person cannot transmit it to someone else. Therefore, if someone takes ARVs regularly they're at a low risk for transmitting HIV. But if someone who's HIV positive, they're taking their ARVs properly, they can reduce the amount of virus in the body so that HIV is no longer able to be transmitted. And that means that it's undetectable. So an undetectable virus means that you cannot transmit it, or it's untransmittable. And again, in order to figure out if you are a person, if someone is a person that needs this treatment, get tested, know your status, get access to life-saving treatment if needed. So another major concept before we kind of conclude the conversation is PEP and PrEP. So PEP is post-exposure prophylaxis, which is a medicine that is taken to prevent HIV after a possible exposure. And this could be during sex, through needles, through sharing needles or syringes, or being in a workplace exposure like a hospital. But it's not a substitute for the regular use of HIV prevention, which are those A, B, C, and Ps that we've talked about before. So we have PEP and then also PrEP, which is pre-exposure prophylaxis, which is a medication that can be taken if a person is at high risk for contracting HIV. So it's not after a possible like PEP, but it's before they are exposed or could be exposed. And both of those, again, need to be taken on a daily basis, once a day, similar to birth control or the ARVs. And many insurance plans and state Medicaid programs cover PrEP. And there are also free medication programs that provide assistance to people that don't have insurance to cover PrEP. And there are also copay assistance programs. So overall, right, you're learning, you're here, you're protecting your loved ones by learning this information, and everyone deserves a test. And in order to get the life-saving treatment if needed, you need to know your status, which means you need to get tested. So get tested, know your status, and get the life-saving treatment if needed in order to in order to be a part of, hopefully, an AIDS-free generation in the future, and break the cycle of HIV transmission and live longer and a happier life. And again, break that stigma. Someone who is HIV positive and taking their treatment every day properly will live a long, happy, healthy life, no different than someone that's HIV negative. Because on treatment, HIV can't be transmitted. And I did not know this when I was first learning about it. So just being here today, knowing this information, reviewing this information, and even if this is the first time hearing about it, you're doing what you need to do in order to break the cycle of HIV transmission. So again, get tested, know your status, get that life-saving treatment if possible. Everyone deserves the treatment. In order to get that, in order to break the cycle of HIV transmission, it's super important to get tested so you know your status to get this life-saving treatment. Thank you for having me today. It was awesome talking with you guys. I'll be here for any questions or concerns you might have, and have a great rest of your day.